NHS crisis, how bad is it? The UK's National Health Service is 76 years old. It was founded on July 5, 1948 by the then Health Secretary Aneurin Bevan. The NHS is free at a point of use for British residents who need treatment. Before its creation, most patients usually had to pay for their own care. Now, it is the largest publicly funded healthcare service in the world. In 2021 and 2022, the Department for Health and Social Care spent £190 billion. This funds healthcare including GPS, ambulances, hospitals, and community and mental health services. However, the NHS is currently facing a series of challenges that are putting it under a great pressure. Let's break down the key issues. First of all, let's talk about the staff shortages. Right now, the NHS is having a difficult time finding enough doctors, nurses, and other healthcare workers to meet the growing demand. Here's the question. Why is it that so many people have made the decision to leave the system and to leave the work that they love so much? Well, long working hours, high anxiety, and sadly, verbal and physical abuse are driving more staff to quit. In fact, over 27,000 staff left from July to September in 2021.
It hurts. It's unbearable sometimes. There have been many times I've thought, I'm just quitting.
There have been so many occasions when I've walked onto the ward and it has been unsafe because of the levels of staffing.
You feel devalued, you feel a little bit worthless, you feel like you're not appreciated for what you do.
Speaking of delays, right now, over 7 million people in the UK are on NHS waiting lists for medical treatment, and this number is growing every month. In fact, in more than 380,000 cases, patients were waiting more than 12 months to start their treatment. Sadly, there are people who are dying because of delays in their treatment, especially those who are suffering from cancer.
I've lost my mum. For them not to even give me the answers I want in terms of change, that they're going to bring down ambulance wait times, they're going to bring down queues outside the hospitals. Sadly, people are losing loved ones because of that.
So why are we seeing these delays? One major reason is funding. The NHS is simply not getting enough money to keep up with the latest medical advancements or properly maintain its hospitals. In recent years, funding for the NHS has not kept pace with inflation, and there have been repeated budget cuts over the years. As a result, many hospitals are facing serious financial pressure. It also makes it harder to recruit and retain the staff needed to provide high-quality care. Now, imagine having to wait for hours or even days in the emergency department to be seen by a doctor. Well, that is another serious issue that the NHS is facing with. Hospitals across the United Kingdom are currently facing a significant shortage of available beds. Every day, more than 12,000 patients are stuck in beds they don't need to be in. And this leads to overcrowded emergency departments, long ambulance waits, and a system that simply can't keep up.
You sit here and you're dealing with one patient and you think, oh my God, what's going on out there? What is going on at that particular call? Why can't we get to them? And then it all starts to come into perspective and you have to sit down, take a breath in and think.
Health inequality is another huge issue within the NHS. This means that not everyone in the UK has the same access to healthcare or receives the same quality of care. Those who are living in poorer areas, for example, often experience worse health outcomes. Some groups like ethnic minorities or people with disabilities may have trouble getting the care they need. Mental health crisis is another issue. Over the past few years, the demand for mental health services has increased rapidly. More people are suffering from depression, anxiety, and stress.
Quite desperate and I just need help. I can't really wait any longer. It's just going to get worse and worse.
However, mental health services have often been underfunded and understaffed, making it harder to meet this growing demand. The COVID-19 pandemic also had a long-lasting impact on the NHS. During the height of the pandemic, hospitals were overwhelmed with COVID-19 patients, causing many non-urgent treatments to be postponed. As a result, many people who couldn't get care during the pandemic are now seeking treatment, further stressing the system. The government has promised more funding, but experts argue that more needs to be done. Otherwise, the NHS will continue to face an uphill battle, and more healthcare workers will leave for better opportunities abroad.